Here's a counter-strain position to shut off a popliteus trigger point. Now the popliteus is palpated if you come up the medial posterior side of the lower leg and come above the roundness of the gastroc muscle belly on the medial side, you will land on the popliteus trigger point. You can also sometimes feel a trigger point right in the popliteal space. So find the trigger point, and then you want to bend the knee more than 90 degrees. So remember, with counter strain, we want to hyper shorten the muscle. So I have my finger on the tender point here to monitor it, and then I'm going to flex the knee past 90, and then I'm going to internally rotate the lower leg. So I have this T-bar grip, I call it, on the foot. If you put your hand here, it's going to be harder to turn, so you want to hold the foot on the plantar aspect in dorsiflexion, flex the knee past 90, and internally rotate. You can put pretty forceful internal rotation here. It doesn't bother the knee. It shouldn't bother the knee, so you want to make sure it doesn't bother them when you do it. And then repalpate the tender point. If the tender point is at least 70% less or gone, hopefully, you will hold this for 90 seconds. 90 seconds. My hand here, my palpating hand, does nothing in this 90 seconds. I'm not trying to do a massage to it. I'm not trying to poke it. I'm simply keeping my hand here to monitor the tender point to make sure the patient remains relaxed. After 90 seconds, then you will passively return the knee to neutral, recheck the tender point and make sure it's less, and more importantly, recheck passive or active knee hyperextension and make sure they're able to do a quad set and hyperextend the knee without getting a pinch in the anterior knee joint line. That's how to counter strain the popliteus.